Hello friends, today we gather to discuss a topic that is both sensitive as well as crucial in our society. Specifically, it is a consideration when one of the spouses has been diagnosed with a long-term illness in the context of a divorce proceeding. It is a conversation that requires a lot of empathy and understanding as well as a deep commitment to the best interest of everyone that may be involved in such a case. When facing the complexities of a divorce, especially when one of the spouses has one of those long-term illnesses or has been diagnosed, it is imperative to approach that type of case with understanding and thoughtfulness. So today we're going to discuss these issues in greater detail. Welcome back to the Divorce Broadcast. My name is Manny Segarra, coming to you from Miami, Florida. All right, it is important to recognize that an illness, especially a long-term illness, can have a profound effect on every aspect of that person's life, from their physical health to their emotional well-being to their financial stability. When it comes to long-term illness, and I'm sure a lot of you already know this, they come with substantial medical costs. So in the context of a divorce, a divorcing couple must address how these costs will be paid both fairly and sustainably, meaning long term. When it comes to these types of cases, oftentimes financial issues are what's paramount. Now we are going to give a brief overview of the different long-term illnesses that may be involved in a divorce proceeding. Remember that this is not an all-inclusive list, that we're just covering a couple of the ones that may come up. We're going to start off with multiple sclerosis, or MS. MS is a chronic autoimmune condition that affects the central nervous system. Patients with MS may require long-term care, specialized medication, physical therapy, as well as assistive devices to maintain their mobility and independence. Next, we're going to talk about cancer, and depending upon what stage of the cancer diagnosis the spouse is in, they may also need long-term care. They may need chemotherapy or radiation or surgery. Additionally, remember that cancer survivors usually need additional monitoring and management in case there's any type of complications or in case the cancer comes back. Up next, we're going to talk about rheumatoid arthritis, or RA. RA is an autoimmune disorder that affects people's joints. It's very painful. It causes joint inflammation and over time may cause joint damage. Long-term care for patients with RA includes specialized medications, physical therapy, as well as lifestyle adjustments to try to protect their joints. Now we're going to mention Alzheimer's disease and dementia. These are very sad neurodegenerative conditions that result in cognitive decline and memory loss. This is a disease that requires significant long-term care expenses, which could include specialized medication. The patient may need assistance with their daily activities. They may need at-home care. They may end up in an assisted living facility or a nursing home. So these are very expensive medical costs associated with Alzheimer's. Up next, we're going to talk about heart disease, whether it be congestive heart failure or coronary artery disease. These are very serious long-term illnesses that can be expensive. Oftentimes, long-term, the patients need a lot of medical care. This can be medications, this can be rehabilitation, there may be a stent involved, or even a heart transplant. Following this, we are going to mention chronic obstructive pulmonary disease, or COPD. These conditions include emphysema and chronic bronchitis. These long-term illnesses require extensive medical care because they are progressive. Oftentimes they need oxygen tanks to help them breathe, so this all has to be thought of in the context of a divorce. Another long-term illness that is prevalent is Parkinson's disease. Parkinson's disease is a progressive neurological disorder that affects the spouse or the patient's movement. It can lead to either tremors or stiffness, difficulty difficulty with balance and coordination. Long-term care for Parkinson's disease is very expensive. It could include specialized medication, physical therapy, occupational therapy, speech therapy, as well as long-term care in an assisted living facility or nursing home. And finally, the last long-term illness that we're going to mention, at least on this video, because there's a lot more, we just don't have time to mention it today, is HIV/AIDS. Remember that although the treatment and advancements in the treatment has improved tremendously over the last several years, it is still a lifelong condition, which means that there are lifelong medical costs as well as treatment. Some of these treatments may include the antiretroviral therapy as well as the monitoring of cell counts. So those are very important treatments and expenses that need to be contemplated in a divorce. All right, so now that we gave a brief overview of the different types of long-term illnesses that may be at issue in a divorce proceeding, let's push through and talk about some of the other expenses and costs that we need to account for in this type of divorce. The first type of cost that may come into play is cost for mental health counseling or therapy. And this could be for both the spouse that has the long-term illness as well as the spouse who is filing for divorce from that spouse. A lot of times these types of divorces come with a lot of emotionally charged issues that need to be addressed by a professional. One of the most important issues that must be contemplated is the cost of medical insurance. Oftentimes the spouse who does not have the long-term illness has coverage for the spouse who does have that long-term illness, either through their employer or if they're self-employed. That employer covers that spouse because it may be a group plan, or maybe they don't penalize them for having a pre-existing condition. In a divorce, the spouses can no longer be on their respective insurance coverages. So that spouse with the long-term illness is kind of in a pickle. They have to decide what they're going to do next. So oftentimes COBRA will kick in, but COBRA expires after a year, couple years at the max. So that spouse with the long-term illness needs to figure out the price of medical insurance for the upcoming years. Plus, as a practice tip, remember to always include the rate hike, because insurance providers, they usually up the price a little bit, 5, 6, 7%, some years a little bit less. A very important point. Additionally, doctor's visits are important, whether it be to the primary care physician, a specialist such as an oncologist, a neurologist, or someone like a cardiologist. It is important for the spouse with the long-term illness to try to figure out what the average is of the amounts of those visits throughout the years with their primary physician as well as any specialist. Another big ticket item is medications. Oftentimes there are very significant costs for prescription medications, and a lot of times people that have long-term illnesses like to use some over-the-counter supplements. These costs for these medications are something that must be contemplated in a settlement agreement. A lot of times a person who has a long-term illness can do is average out the cost of the monthly medications and contemplate that number when trying to figure out a settlement or financial support in the future. Additionally, the spouse with the long-term illness should consider the future costs of medical equipment and supplies. This may include wheelchairs, Hoyer lifts, CPAP machines, mobility devices, oxygen tanks, and insulin pumps. The expenses for any type of therapy, whether it be physical therapy, occupational therapy, speech therapy, respiratory therapy, or any of these types of rehabilitative services, should also be contemplated as a future cost in these divorce agreements. Specialized treatment for some of these long-term illnesses that we discuss, such as chemotherapy, radiation therapy, dialysis, infusion therapy, and immunotherapy, are all different types of therapies that are necessary for some of these long-term illnesses. Another major cost is home health care, and that is getting a nurse or a healthcare worker to go out and assist the person with the long-term illness in their homes as the disease progresses in the future. Home healthcare expenses are skyrocketing. This is something that needs to be contemplated in a divorce agreement. Along those same lines would be the costs associated with an assisted living facility or a long-term care facility like a nursing home. These costs have skyrocketed across the country, so it is important that if a spouse in the future may need a long-term care facility, that the cost and payments of this facility are contemplated when the parties negotiate their settlement. The final final expense that we'll touch upon is the remodeling or the accommodation of the post-divorce home for the spouse with the long-term illness, whether it be the marital residence or a subsequent home. This could include installing ramps and handrails, widening the doorways and the hallways so that they can get through a little bit better, changing the bathroom up so it's accessible, including the ability to get into the shower and on and off the toilet, and finally modifying the kitchen so that the spouse can reach everything that's necessary in the future. These are all really expensive accommodations of an existing house, so the parties need to think about this when they reach their settlement in a divorce if one of the spouses will remain in the house and it's the spouse that has a long-term illness. Now that we have discussed some of the expenses that would relate to a spouse with a long-term illness and a divorce, let's talk about how that spouse can try to obtain some of this financial support in order to be able to afford some of these. And the first way to do it is to try to treat these future expenses as a marital expense in the form of equitable distribution. Specifically, if while the case is pending, these expenses are ongoing, then the spouse with the long-term medical illness should try to get those payments, or at least half of those payments, to allow for them to receive their medical treatment as part of equitable distribution. They should also try, if they can, if their particular statute allows for it, and remember each jurisdiction is different, to try to categorize this future expense of whether it be medical treatment or modifications of the house as a medical expense, to see if the court would grant them at least payment for half of what these costs may be in the future. When it comes to ongoing medical expenses, the second way to perhaps be able to allow for this type of expense in agreement is through alimony. Now, Florida law has changed recently. We did a whole video on how the alimony statute, Florida statute 61.08, has been modified and changed. As a quick recap, remember that Florida law no longer allows for permanent alimony. So what has happened is that a lot of times the courts will award durational alimony if there's a need and ability to pay. Durational alimony can only be in a short-term marriage, which is 3 to 10 years. It can only be for a length of half the length of the marriage. So in a short-term marriage, if they're married 6 years, it can only be a 3-year alimony award. In a moderate-term marriage, it can only be 60% of the length of the marriage. And in a long-term marriage, which is anything over 20 years, the alimony award can only be 75% of the length of the marriage. Now, what the statute did, which is great, is that it stated that under exceptional circumstances, and I'm reading Florida statute 61.08, the court may extend a term of durational alimony by showing clear and convincing evidence that it is necessary after applying certain factors. And one of the factors, which I believe has to do with spouses that have long-term illnesses, is the extent to which the obligee, which is the person who receives the alimony, is mentally or physically disabled or has been diagnosed with a mental or physical condition that has rendered or will render him or her incapable of self-support. So that is the loophole. What would happen in a case involving a spouse with a long-term illness is that that spouse would say, Judge, I have exceptional circumstances. I have, for example, MS or RA or a chronic heart condition. I will not be able to take care of myself. Not only do I need medication, I need therapy, and I need long-term care. Therefore, my need for alimony is such that I need alimony for these expenses, but I also need it for a little bit longer time than what the legislature mandated as the presumptive guideline. So there is the loophole to try to get a little bit longer financial assistance when the issue of a long-term illness arises. The final way, or the most common way, to probably try to get the financial assistance necessary would be if in the agreement the spouse with the long-term illness or the spouse who does not have the long-term illness, if they come to an agreement that they will reserve or have the court reserve ruling on these future expenses. What that means is in the agreement they agree that at a future time, let's say the kitchen in the house needs to be modified, then the spouse that needs the modification of the kitchen would file the appropriate motion or pleading in court asking for a contribution from the other spouse, and then they would have to have an evidentiary hearing. Of the three scenarios, whether it's treating it as equitable distribution, alimony, or having the court reserve jurisdiction on the issue of assistance or financial support for these payments, each jurisdiction is going to be different, but either way, it is very important for the spouses to try to contemplate these expenses. All right, so we covered a lot today on the video. We covered the different types of long-term illnesses, what some of the expenses associated with them are, and how to try to negotiate or address these issues in court. It is always better to have the spouses come together and try to format a long-term plan for the medical care of that spouse that has long-term illnesses. Again, we didn't mention all the long-term illnesses that are at issue. We would love to hear some comments for anyone that's suffering from a long-term illness that may be at issue that we didn't mention. We'll respond accordingly. We support everybody who may be dealing with these issues, so hopefully we didn't slight anybody. All right, so that is a wrap on addressing the issues that may come up when a spouse has a long-term illness in a divorce. If you know anyone that may find this information useful, have them look us up at www.segarralawfirm.com. We have offices in Miami and Orlando, Florida. Se habla español. Please do us a favor and like this video, subscribe to the Divorce Broadcast, and we will speak with you all soon.